passage into the teenage years. But how do you know when your child is ready for the mouth hardware? We invited orthodontist Dr. Jennings here to answer your questions. Good morning to you. Glad you're here this morning.
Appreciate it.
Yes, and it seems like back to school, we're all thinking about all the things we need to do to help our children do better in this world. And teeth are a really important part of that, aren't they?
Yes, definitely. Many people don't realize that how much a smile contributes to their life. You know, it helps build their self-esteem. It also helps. There's things that they don't even think about, like how it contributes to eating, speaking, TMJ problems, how that's related to the bite. There's all kinds of things.
Well, hopefully people are starting early in life to take those kiddos to those every 6-month dental appointments, and hopefully your dentist kind of leads you in the right direction of when you need braces. But what is the ideal age that you really might want to start thinking about it?
I like to get them in around age 7. Usually stuff isn't needed at that time, but it helps me identify the kids with significant growth and development problems or severe crowding. Because if you catch it early at that time, it can save for many problems if we wait till about age 12 when they get all their adult teeth.
So if you're seeing any problems by the age of 7, you already want to see them at the orthodontist, not just with the dentist saying, keep an eye on it.
Yes, so like whether you, because I've seen it so many times over the years where even their dentist hasn't mentioned coming in, but we found some things that ended up being big problems, and we were able to take care of it right then.
We were just looking at a list of some of the problems, so maybe someone who sucked their thumb a little later in life than normal, or perhaps you're seeing some wear and tear on teeth that doesn't look quite normal. It shouldn't be there that young.
There's things you don't even think about. Mainly teeth being stuck up in their jaws that we can catch. You have to see it on an x-ray, but if we catch it right then, it could be very simple.
Now, the good thing is braces have come a long way, baby, since back in the day when I had them and I was called metal mouth on a regular basis. You brought in some examples to show us how far we've come. Now, the other ones are still just fine and dandy. I think they look cute on kids, but some kids don't think so.
No. And so, well, with braces, they're glued to your teeth, okay? And we start you out with the small wires and work our way up to bigger wires. Typical treatment time is about 20 to 24 months for full braces. Some of the things you got to think about with braces is brushing and flossing is critical at this time because you can pack stuff in there.
Do you still use a water pick like we did back in the day, or has that changed?
Whatever you can.
Whatever it takes to clean them.
Yes, you've seen what the kids are like when without braces. It's bad enough right there. So one thing, you know, it's also they got to watch what they eat. Let's make sure they don't break anything.
Okay, now you also have a clear version. And this might help maybe especially the older teens.
If they're getting close to high school, Invisalign is an awesome option here because what they're clear aligners that are removable. And so what you do is you wear them about 20 hours a day and you change them out every week or 2, and typical treatment time is also about half that of braces is what I found.
And then what about the finances between the two? Is the clear version more expensive, or are they about the same?
No, it's in my office, it's exactly the same.
Oh, it is? Okay.
No difference.
And then just quickly, because we're out of time, I know it can be a financial burden for people. It's one of those things that sometimes you can pay it out to try to help that out a little bit.
Oh, absolutely. Insurance covers it, part of it, and also most orthodontists finance it out at 0 interest.
Dr. Jennings, good information to share. We hope to help those kiddos and have the best self-confidence they can in their smile.
Yes, thanks for having me.
All right, have a great